Hello. This video is going to be on ultrasounds. Now there are a lot of ultrasounds in the book, and I can't speak to all of them in a short video, so I am skipping over the diagnostic ultrasounds for head and neck, and for the chest, the abdomen on page 413. And I'm coming right to page 414. Now the book that I'm using is a 2014 CPT code book by the American Medical Association. If you have a previous year's book, you could still use that, but I would pause the video to find the page where your obstetrical ultrasounds are. They're in the pelvis area. The first code you're looking for is 76815. So in my book, I'm not so sure how well you can see the coloring, but I did some color coding so that I would quickly be able to find the guidelines that pertain to each code. So I'm not so sure you can see the coloring clearly, but I have a red outline for 76801, 76802, and then I've underlined them in the guidelines in red, 76805, 76810 in green, and I've underlined them there. Orange for 76811, and I've underlined them here, and the code continues on to the top of page 415. And I've done that throughout the book. Continuing on, when we get to 76805, I've changed my strategy a little bit, and now I'm circling in red. And so you can see right here, and 76816, and you can see it matches right here in green, and 76817. So these are the obstetrical ultrasounds. And when we talk about obstetrical ultrasounds, you're going to see that they repeat the word pregnant uterus. And the reason why they do that is they want to make it clear that we're talking about obstetrical, because in this pelvic area there are non-obstetricals where they could be looking in the abdomen, particularly the uterus, to see if there's any polyps or growths in it. So they're trying to carve it out that these are for pregnancy. So 76801 and 76802 occur during the first trimester. 76805 and 76810, the same thing is happening as in 76801 and 02, but they're after the first trimester. So let's look at these codes a little bit deeper. It says ultrasound, pregnant uterus, a real-time with image documentation, fetal and maternal evaluation. First trimester, and they describe the first trimester as being less than 14 weeks. It's a transabdominal approach. Right. It says single or first gestation. So they're not talking about the first time the mom is pregnant. They're talking about in terms of how many babies she has in the womb. So if you had a single child pregnancy, you would just use 76801. 76802 is for each additional baby. So if you had twins, it would be 76801 and 76802 with 1 unit. If you had triplets, 76801 and 76802 with 2 units. 2 and 1 is 3. Quadruplets, it would be 76801 and 76802 times 3. 3 and 1 is 4. Now 76805 and 76810, the same thing. These are your standard ultrasounds that they give to every mom when she comes in after her first prenatal visit. They choose which one they're in by where they are in their pregnancy. You don't get both of them. You don't get this one during your first trimester, and then later on after your first trimester you get another one. You get one of them, and it depends on when you come in to see the obstetrician where you are. So some women come in to see the obstetrician in their first trimester. Some women don't come in until after their first trimester has passed, and so then they would be in these series of codes. So these are just standard. They're going in there, getting their baseline, looking around, making sure everything is as it should be. Now if they see something in one of these here that makes them suspect something is wrong, for instance maybe the way the placenta is placed, then they would go in, have you scheduled at a later date for 76811 or 76812, and the 76812 is again for each additional baby that's in the womb. And so we have the guidelines for them. Right over here in the lower left-hand corner on page 414, it says code 76811 and 76812 include all elements of code 76805 and 76810. right? So that would be this. They also include all the elements of this because these have the same elements, plus detailed amniotic evaluation of the fetal brain, the ventricle face, heart, outflow tracts, and chest anatomy, abdominal organs, specific anatomy, and it continues to go on and say the placenta, the umbilical cord. And so they're doing this because they've suspected something is wrong. So this isn't a routine one that they give all the time. That's when they've seen something that's out of place, or the mom is showing some symptoms that make them believe something is going on and they need to do this one here. So this is for the first baby. It's transabdominal, right? So it says transabdominal approach, single of first gestation, and then in the upper left-hand corner of the next page, 415, you have it for each additional baby. 76813, this is an ultrasound for pregnant uterus real-time with image documentation, first trimester, okay, fetal nuchal translucency measurements, transabdominal or transvaginal. It also has each additional gestation, so each additional baby that's in there. Now, fetal nuchal translucency, this is a test, a non-invasive test that they do for Down syndrome. So they are looking at the folds at the back of the neck. On the course website where I have this video, you will also see I've uploaded information from Wikipedia on the fetal nuchal translucency and how they use it to look for Down syndrome. So it's less invasive than an amniocentesis. Okay, 76815, ultrasound pregnant uterus real time with image documentation limited. And they give you an example. They may just be looking at a fetal heartbeat, the placenta location, the fetal position, how much amniotic fluid. Maybe they think they have too much or too little. And it's for one or more fetuses. So this one doesn't have the each additional code for it, for one or more fetuses. So you only get to code this once. So no matter how many fetuses you have, you only get to code this once. So the guidelines for it are right here, 76815, and there is a typo in this paragraph. 76815 represents a focused quick look exam limited to the assessment of one or more of the elements listed in, and this says 76815. It really should be 76811. All right, so it's something that was found in here, and they're doing a quick follow-up on it. Something that's very common is placenta previa. They may have, in your initial one here, didn't like where the placenta actually was, and so they wanted to have a further, deeper look at it, so they did use 76811, and it truly did show that you were placenta previa. Then they would have to do follow-ups of 76815 throughout the pregnancy to see if that moved, because if it doesn't, you would not be able to deliver vaginally. Okay. So moving on to 76816, ultrasound pregnant uterus real time documentation follow-up or reevaluation of the fetal size by measuring standard growth parameters and amniotic fluid volume, reevaluation of an organ system suspected or confirmed to be abnormal on a previous scan, most likely 76811. Okay, and this says transabdominal approach per fetus. So this one's a little bit different. This one said one or more fetuses, which meant you can only code this code once. This one says per fetus. So they didn't give it an each additional add-on code like they have for 76812 and 76810 and 76802. They didn't give it a code for each additional one, but it clearly says per fetus. So how you code this, and there's a parenthetical note in the guidelines, it also speaks to this. You would code this multiple times, however many fetuses you have. And each additional instance of 76816, not the first one, each additional one would have modifier 59 appended to it. So for twins, it would be 76816, an additional instance of 76816 with modifier 59. And if you had triplets, then you would have 76816 coded 3 times, and the second and third time you would have modifier 59 on it. So you have that in the parenthetical note down here, okay? And also in your guidelines up here. So it explains that it describes an examination designed to reassess fetal size and interval growth and the reevaluation of one or more amniotic abnormalities of a fetus previously demonstrated on an ultrasound, and it should be coded once for each fetus, requiring reevaluation using modifier 59 for each fetus after the first. 76817 is a transvaginal. So all of the codes that we looked at already, with the exception of 76813, 76813 says that it's transabdominal or transvaginal. So we have to, this one cannot have 76817 used in addition to it because it already includes transvaginal. But all of the others are transabdominal, and if they couldn't see completely 100% what they needed to see, and they also had to do a transvaginal view, you would get to add on 76817 in addition to the code for the primary ultrasound. And your parenthetical note does tell you that down here. If transvaginal examination is done in addition to a transabdominal obstetrical ultrasound exam, 76817 in addition to the appropriate transabdominal exam code. Now this isn't an add-on code, so when you add it on to one of the others, you will have to put modifier 51 for multiple procedure. Okay, 76818 and 76819. So these are biophysical profiles. So similar to a physical exam on the fetus in utero. So 76818 is with non-stress testing. So they are doing a stress test. Right? They use it in the negative non-stress testing. So this is with non-stress testing happening. Okay, and 76819 is without non-stress testing. 76820 is a Doppler fetal umbilical artery is what they're looking at, and 76821 they are looking at the middle cerebral artery. 76825 is a echocardiography, so it's they're looking at the cardiovascular system. It's a 2D examination, a 2D image. Okay. 76826 is a follow-up of that cardiovascular exam, or a repeat study of that cardiovascular exam. So 76826. 76827 is a Doppler echocardiogram fetal pulse wave and or continuous wave with spectral display, and it's a complete exam. And then if they have to come in for a follow-up or a repeat study, 76828. So all of these here involve them looking at the fetus, right? But it's all on the maternal record because it's before the mom has delivered. It's going to be billed under the mother, and it's all on the maternal record, right? Even though they are looking at the condition of the fetus. Then we move on to non-obstetrical pelvic exams. And I've done the same thing. Fortunately, the codes are on the next page, and they have the guidelines on this page right here. So you can see I started the color coding here with my orange and my yellow, and you can see that I've colored the codes in orange and yellow. So 76856 is a pelvic ultrasound, non-obstetrical, and it can be done on a male or a female. So they could see the uterus and the abdomen and the organs that are in the abdomen. And you notice there's two paragraphs for it. So one speaks to the female, so they could be looking at the bladder and the uterus, and then one speaks to the male and what they would be looking at for the male. Right? So they could be looking at also the bladder and the prostrate and the seminal vesicles. So I encourage you to read these and match them up to the code so you understand what's happening in the code. Right? And I've made my note here, male or female. Right? 76857, and that's a limited or follow-up exam to 76856. Right? So this is a limited or follow-up. So they've already had this done, and then they're doing follow-up exams, and it includes one or more of the elements that they looked at in 76856. We move on to the genitalia ultrasounds. 76870 is ultrasound of the scrotum and its contents, so that's just for a male. 76872 is ultrasound transrectal, so that is for a male or a female. And 76873 is prostrate volume, so that's just for a male. Then we have the extremities, 76881, and so that's for the extremities, non-vascular, real-time with image documentation. It's a complete exam, and the 76882 is limited to one anatomical specific anatomical. So the left arm, the right arm, the left leg, the right leg. 76885 is the ultrasound for the infant's hips. So the infant could have a hip click or a stiff hips, or the leg could be turning in, or the foot could be turning in or out. And so they will do an examination of the hips. They push the knees up. They move the legs in to different positions so that they can examine the joints thoroughly and see what the problem is in the joints. 76886 is a limited static, not requiring a physician or another qualified healthcare professional to manipulate. So this is 76885 includes those manipulation of the hips, and 76886 does not require such manipulation that it has to have a physician in the room. All right. The rest of this is ultrasonic guidance procedures. I'm not going to talk about them, but what I will mention about them is in other areas of the book, other surgical areas, you'll see parenthetical notes that will say for ultrasonic guidance for radiological assistance. It's referring you to some of the codes in these 7000 series. And what those are referring to is you did some kind of guidance, and when you look at these codes, you will see that in the parenthetical note, it will guide you to one of these codes. And this code, when you look at this ultrasound or this radiological guidance sound code, it will tie right back to the specific procedure that led you here. And so when you see those parenthetical notes saying that if you had ultrasonic guidance, radiological assistance, you're going to use both of them. You're going to use this code in addition to that procedure code that you're using. So this is pelvic ultrasounds. I hope you found this helpful. For those of you who are in my classroom, feel free to ask me any questions on the codes that I spoke about, or any of the ultrasonic codes that I did not speak to at all. And if you're in my online course, feel free to email me on any of the codes I spoke to, as well as any of these ultrasound codes that I did not speak about. I hope you have found this very helpful, and thank you for watching.